Well, thank you very much for that lovely introduction. And yes, that's my background. It's very interesting to hear about other women's experience of menopause and perimenopause. And I use the word menopause to cover every type of menopause: perimenopause, postmenopause, early menopause, premature menopause, medically induced menopause, surgical menopause. And I can tell you that I spent 25 years or whatever in the corporate sector minding my own business. And when I was 49, I had what was to be my last period. And very soon after that, I got hot flushes. And so my story is similar but different to Leah's, and that I got, they were the only two things I knew about menopause: no periods and hot flushes. The immediate thought was, well, first of all, I'm too young. Surely at 49, I'm too young. This is a much older woman's condition. Secondly, I thought, well, I don't know anything about this. None of my friends are talking about it. Nobody I know talks about it. My mother never mentioned it. So I better find out. So I consulted Dr. Google, typing away, only to receive very conflicting information. I was absolutely terrified of HRT. This is about 10 years ago. So I was absolutely terrified of HRT. Born out, or, I had no information about it, but I just was terrified. I'd heard, and there was a narrative in my head, it was dangerous, and so on. I also thought that strong women power through. And so I was going to power through menopause. Now, interestingly, when I went to have my babies, I was, I nearly knocked down the staff at the front entrance asking for the epidural. So I was never going to power through childbirth. I know some women do, but I didn't and didn't want to. But I was definitely going to power through menopause. I don't know why. So this is how rational or irrational we are. However, the interesting thing is I never heard the word perimenopause. So all the symptoms that I experienced throughout my 40s went unconnected to menopause. And eventually, after 3 years of putting up with the symptoms, I gave in and went to seek medical help. So I'm doing it in inverted commas, but because of the background, you can't see them. And went to see my doctor. The GP consultation was fairly kind of all right. But I decided to go somewhere else and spoke with someone for about an hour, paid a lot more because of expensive healthcare in Ireland. And I got a whole education about menopause, about estrogen, about all my symptoms, about the whole 2002 Women's Health Initiative study, about whether HRT was for me, hormone replacement therapy, etc. And I decided I was going to go on this. I had information, I was empowered, I had facts rather than fiction, and I was making a decision. So I started on estrogen. I then went on testosterone. Well, sorry, estrogen and progesterone together because I still have an intact womb, uterus. I then started after 3 months testosterone, which I didn't know women even needed or could take. And that was like, for me, a missing piece of the jigsaw. And all of a sudden, my hot flushes were gone, my va-va-voom, my joie de vivre, all that thing, my vitality, my mojo, everything was back. And I was just back to my old self. So that caused me to start investigating with other women about what their situation was. And the interesting thing is, so if I go through my symptoms, I had about, there's a never ending list at this stage, but on our Menopause Hub, we have a symptom checker, we call it, that we give to patients, and we ask them to complete it in advance of coming to see us. We have an app in development that will track symptoms and so on. But there's about 40 odd symptoms. Could be 40, could be 50. I read 62 last week. It depends on, how you divide them down. But when I look back, I had so many symptoms of perimenopause. I was going from one specialist to another. So to give you an example of some of my symptoms, and you see, I'm not in the throes of it anymore because my symptoms are all under control and I feel great. But when I was, life was difficult. It was challenging. The same words that Leah used. It was isolating. It was lonely. And it was really difficult to navigate. And this is before we've had Davina McCall coming and talking about menopause, before we have menopause policies. We have lots of conversations, all the celebrities, menopause shampoos, and all the rest. So we're talking 10 years ago. So when I look back, so I had headaches. I was sent for a brain scan and everything was fine, thankfully. I also developed focal migraine. Nobody mentioned menopause. I had acid reflux and was sent for all those tests with, cameras and scopes. I had pains in my ankles, which I would never associate with menopause. I had dry eye. I ended up in our local eye and ear hospital in their A&E department 3 times. I first of all thought I must have something like a brain tumor or something because the pain was so bad. And when they said to me it's dry eye, I couldn't believe it. I then went I had urinary tract infections all the time. So I was on antibiotics 6 months at a time. Then I get thrush, then on diflucan, then back to the antibiotics. I actually developed asthma, which women can develop. So before that was diagnosed, it was chest infections, and I was on antibiotics for those. I developed sinusitis. I had bladder leakage. So when I laughed, coughed, or sneezed, I had urinary stress incontinence. Got up to go to the loo in the night, nocturnal incontinence. I had night sweats, which I just put down to I was a bit warm. I was fatigued. I described myself as a slow puncture. So these are all the symptoms. Loss of libido. I didn't have as many of the, psychological anxiety and all the rest symptoms, I'm pleased to say. But my mood was very flat. And instead of walking on a flat surface like that, I always was on a bit of an incline. So it took all my resources to get through the day and just live a normal life. I'm a single parent. I reared my children myself, and they're over 18 now, so I call them my kiddos. I was working full-time outside the home in fairly senior roles, running the home and, earning the only income and so on. So I went to my doctor as I said, in my 40s, and I remember saying, I'm sick all the time. Why am I always sick? And the doctor said, look, you're just having a bad run of things. Nobody mentioned perimenopause. I was incapable of joining the dots, and no one else was joining them for me. So when I got to feel really well, I said, right, that's it. I'm going to do something to help other women. If I have a magic wand to wave, I want every woman in the world to know about menopause, to know perimenopause, what the symptoms are, what the treatment is, etc. And I wanted to empower them through information, through facts, not fiction, to be able to actually empower themselves to seek treatment if they need it, but to actually, get themselves and manage their way through menopause. So I set up the first clinic without any medical background, I must say, so I have to say that was a feat in itself. And sometimes little knowledge is a dangerous thing, or sometimes, ignorance is bliss. So if I knew then what I know now, I may not have done it. But I got one of the doctors in Ireland who was a leader in menopause to help me establish the clinic. Now we've 11 doctors, we've a consultant gynecologist, we have nurses. I actually think advanced nurse practitioners and prescribing nurses have a fantastic role to play in this area, and there's just not enough of them in Ireland. But anyway, I think that's a great breakthrough for us. I also, so we have these 3 clinics. So we have evidence-based treatment, we have a psychologist, a women's health physiotherapist, a dietitian and nutritionist. We're bringing on board a sleep specialist, particularly someone in ICBT, which is for insomnia. And we're bringing on board a mental health specialist. So we offer evidence-based, holistic in as much as possible treatment. So what I was going to say then to you is, right, I also do a lot of advocacy. So I'm talking to ministers and government and to anybody who will talk to me, to media, everybody. I've done work with the Irish Nurses and Midwives Organisation in Ireland. And I worked with them on their position paper or position statement on menopause back in 2019. They've also done research in conjunction with us about menopause and how that impacts women. And 82% of their members who experienced menopause said that they considered giving up work due to their symptoms. So you can see that this profession, which is highly focused and dominated by women, also, is also one with a lot of risks, because women can walk out, and the likes of Leah, talented, experienced women walking out because they can't get the support for what they need, and they find it difficult to work as a menopausal woman. So the advocacy is a big thing. And then the third area I'm really busy in is the area of menopause in the workplace training. I also do. We also have CPD accredited e-learning, as well as hybrid, as well as live training, and we aim it at 5 key audiences: all colleagues, managers and supervisors, HR, and menopause champions. And I'll come on to talk about a couple of the points that Leah made there, menopause champions and then senior leaders. And it's interesting because I agree with her about the policies. The policies all contain a lot of things which sound great in principle. And I deal with all sorts of organisations. So I've worked today in Ireland, we worked with the civil service and they've introduced, I know I haven't shared my presentation, but I'm thinking about the time and wondering, is there a point in sharing the presentation? Because basically what we have is that the civil service have launched a policy which is going to, it's the policy framework that will be used as a template for the rest of the public service. And my concern about some of these things is that most people in the civil service will be working in a desk-based job. So a desk-based job is, it could be at home or it could be in work. So they can get access to some of these things that are talked about. But I also do training with organisations, nurses, do training with the post office workers who go out and deliver the post, who work in big parcel businesses, who work in kind of warehouses, women on factory floors, women who drive buses, who drive trains, women who are, today we were talking to air traffic controllers. You know, these people are in roles where they just can't get up and go and take a little break in a room, and they can't go and, you know, take time out. Some women told us they had very heavy bleeding, flooding, a bus driver, she couldn't get off the bus to change her pads, her clothes, and those kind of things. So these are the kind of circumstances that we're talking about. So what we're trying to do is we're trying to get organisations to look at menopause through the lens of a menopausal woman in the workplace. And whatever your workplace is, I can't advise you about your workplace. You're best placed in your workplace. So we need risk assessment. We need occupational health to be involved. We need maybe chief medical officers to be involved. We need women themselves to speak up and to talk about their personal experience, because it's only through that we will get to find out about what happens on the ground in work. I've said, imagine this, why don't you reduce the shifts? Why do they have to be 8 hours? Why can't they be, why do they have to be 12 hours? Why can't they be 8 hours? What about, changing rotas and changing shift patterns? What about some of these different things? I spoke to nurses who told me that they were on the medicine trolley dispensing medicines. And they said because of brain fog and memory loss and those kind of things, they didn't feel confident. So they had an informal arrangement with another colleague to take over their trolley, and they went and did some of their colleagues' work. That's not good enough. An informal arrangement. So this is why we need to, this is just the beginning. This is just the tip of the iceberg. Now, I'm concerned about time, 1950. So do I have time to show any charts, or do we want to move on to questions? Can't hear you.
I have to unmute myself. Yeah, you have we can run over a little bit, I think.
Okay.
There's a few questions coming through, so do.
Okay. I'll just show a couple of slides that I think might be important, and I'll just pull them up here, and I'll just fly through the ones that I think are of any significance. So that was me, right? Obviously, cardiovascular disease is the theme this year, folks. Women have an increased risk of cardiovascular disease. It's the #1 killer of women globally in the UK and Ireland. So we need to be looking out for our heart health, which gets worse as we become postmenopausal. And therefore, we need to consider this for the future. So the spotlight is on cardiovascular health. But the two other diseases that we have is osteoporosis, osteopenia. We're at huge risk of this, women, because we lose 2% of our bone density a year, and Alzheimer's and dementia because we have those estrogen receptors in our brains. So this is something from the Nursing Times, and this supports exactly what Leah said and what I've also said, is that, they're saying that menopause is destroying some nurses' careers. This was said at the Royal College of Nursing in Brighton at their conference earlier this year, May 2023. It's not only menopause; it's actually menstrual health. It's lots of other areas of women's health. They said women's health is a workplace issue, and we need employers to step up now. It almost destroyed my career dealing with endometriosis and menopause. So Leah's not alone. And none of you are alone. So I do think it's really, really important for people to get your voices, to get into your unions, to get into all of those people and start putting forward your case around this, because it's only when we keep bashing down doors, we keep focusing on the issue. Data is so important, because if you could size the problem and say X many nurses feel this or said that or want this or want that, you actually start to make it something that's actually a compelling business argument. We've gone through a bit about menopause, but I just wanted to show you, we have over on our symptom checker, and this is in the resources, divided into mental, emotional, psychological symptoms, the physical symptoms, and then what we call the genitourinary. They're the ones that can affect us in the pelvis, in the bladder, in our genitals, and can also impact relationships and sex life. Our survey, we did a survey this year among 3,000 women, menopausal women, and 65% of us told us that menopause negatively impacted their sex life. So it's not just confined to women, it's not just confined to work, it's actually it's broader into the partnerships, relationships, and families. So you can see all these different symptoms and you can check it out. If I'd had this in my 40s, I would have saved myself 7, maybe 10 years of suboptimal health, going to this specialist and that specialist. I actually would have done myself a huge favor. I would have been more productive. I would have been in better health. I would have felt better, and everybody around me would have felt better. So I just think getting the information out for women is really, really important. 80% of women will have symptoms. So you may not have them all on the mental, emotional, psychological side. You may not, you may have them, dotted around. They may come and go and so on. And it's very easy to mix up with other symptoms. And particularly COVID has played havoc with women's hormones, as has the vaccine. And so therefore, and women get confused between COVID and long COVID, or between underactive thyroid and so on. But actually, if you've ruled out all those other things, have a look at this. Once you're over the age of 45, it's likely to be menopause. There's lots of different help out there. Diet and lifestyle, the cornerstone. There's herbs and botanicals, although some women say they may as well be, taking Smarties. Others say they swear by them. There's hormone replacement therapy. Has had a bad rap since that study in 2002. But I'm sure lots of you in the nursing profession know that it's actually safer than we might have been led to believe. There's a role for testosterone in there. There's a role for vaginal estrogen, whether it's through pessaries or cream, and obviously estrogen and progesterone. The Mirena coil is something that actually is really, really helpful for some women for that heavy bleeding, once you've ruled out any abnormalities. But also in terms of it delivers your progesterone for your HRT, your hormone replacement therapy regime, and it can be a contraceptive. So that's a very useful part of your treatment. And lots of women experience flooding, really heavy periods, and this can work wonders for them. There's non-hormonal medical choices out there as well, need to be prescribed by doctors. And in the US this year, the FDA approved a new drug for called Vazoa, which actually acts on the brain and helps interrupt the pathways so that it can help with hot flushes. Now, it's not available in the UK yet, or Ireland that I know of, and it's extremely expensive in the US, but it is coming. So there are people looking at non-hormonal treatments. CBT, cognitive behavioural therapy, that's proven by the British Menopause Society to help with menopause in terms of hot flushes. So it's scientifically proven. Hot flushes, anxiety, panic attacks, and sleep. And then the whole area of pelvic physio, I cannot stress it enough. We do not need to be leaking. Sensitive bladders is made up by the marketing community. We don't need to have leakage at any age in our lives. And why menopause matters is because in the UK, almost 8 out of 10 menopausal women are in the workplace. That's a huge number. And Leah's already said 900,000 left work, according to Bupa. It's your fastest growing demographic. You cannot keep women in work in this age group. Pension age is increasing. We're having to stay in work longer. And by 2030, there'll be 1.1 billion menopausal women on the planet. So if we all unite our voices and demand change, we can't be ignored for much longer. And women talked about problematic symptoms in work. They talked about lack of support and discrimination in work. And they talked about loss of income and reduced work. And Leah is a fantastic, well, I won't say fantastic, but she's an example. Don't mean she's a great example, but a sad case in the situation that the woman feels that she has to go to those lengths in terms of her career and so on. And when the UK study did, the House of Commons did their piece of research, what they found out was that these are the top symptoms that affect women at work. Difficulty sleeping, so they're exhausted. Problems with memory and concentration, so they start to doubt themselves and their ability to do the job. Hot flushes and night sweats are up there. Anxiety and depression. So everything Leah said is actually, the case for many, many women. And there's other things further down. Of course, all my symptoms are lower down. It's not awful. Anyway, there you go. And the next chart, if I was to show you, sorry, is that what way did the symptoms affect women? 72% said I feel less able to concentrate. If you're in a job that requires maximum concentration, what hope do you have? And over 12 hours, that's a challenge. I feel more stressed. We're already stressed at this stage of our lives. We're the sandwich generation, elderly parents, kids who maybe, teenagers, children working full-time or part-time outside the home. We've got a lot going on, and then layer in the hormones, and I feel less confident in my abilities. Women already suffer with imposter syndrome. So 67% said that they feel less confident. No wonder they consider giving up work and leaving. It impacts us in our performance. We take more sick leave. 31% was the number there in sick leave. 10% of women in the UK said they left their jobs because of menopause. And day in, day out, I meet women like this who say, I gave up work because of my symptoms. But most people don't really know the reason they gave up work because they weren't even aware it was menopause. And so menopause in the workplace is important. And they're all the things that we can be doing. But obviously, you need to look at it through the lens of menopause in your workplace and your type of work. So I'll hand over there because I don't really like running over time because then it takes away from questions. So back to you, Sue.